Hey, so I wanted to make a quick video for first-time travel nurses and the questions that I typically like to ask a facility before I accept a position. So the first thing that I ask is usually, what type of unit is it? Because you want to make sure that you are within your scope of practice. And also another question is, what is your float policy and where I would be floating to? The next thing to ask is patient to nurse ratio because you want to feel comfortable with the amount of patients based on your specialty. Another thing to ask is what kind of equipment that they use, such as pumps or the charting system. The next thing that you want to inquire about is orientation length. Some facilities give you a few hours, which I've personally never had received before. I usually get anywhere between 1 to 2 days of training. The next thing that you want to ask is what types of drips that they use because you want to make sure that you are familiar with those drips and be open and honest with the ones that you don't know. And sometimes they'll even train you. I didn't start off knowing anything about an insulin drip, and my last facility knew that. And I was trained on how to do an insulin drip. So just be open and honest with that. Another thing to ask is what types of patients you're going to be dealing with. The next thing that you want to ask about is available support systems. Will you have a doctor available on call 24/7 or in-house? Will you have pharmacy 24/7? Will you have imaging 24/7? Transporters throughout the night, CNA help, or even a code team? Also, you want to follow up with some questions on what uniform color that they have because a lot of people forget this. And the most important question to ask is if they have guaranteed hours because the last thing that you want is to duplicate expenses and have them cancel multiple shifts on you. So, that is my tips, and I hope you found this information helpful, and you guys have a great rest of your day.